Dr. Patino here at the Cosmetic Surgical Center of Costa Rica. We're gonna do liposuction. This is micro power assisted liposuction. Look at the tip, how it vibrates. It's like I compare it to a toothbrush, an electric toothbrush, right? Where you don't have to be going in and out at full speed. Although some surgeons that have this device do precisely that. And when you brush your teeth, all you gotta do is gentle, right? You don't have to be going in. Let the electric tool do its work. And what it does is it also makes it much less likely that we're gonna perforate an internal organ or something, because it's very controlled, it's very slow. It's like, I compare this to driving, like driving slowly, right, on the road. It's less likely that you're gonna, whoops, find something, right, and like that. So we don't want oops. And look at this, look how beautiful. Yeah, and look, when you do this, it's many things. It's not just like, but the most important thing is the speed. The speed of the surgeon here is like driving a car, right? That's the most important thing. But to obtain this yellow, beautiful aspirate consistently, all the time, all our patients get this output, right? It's not just one or two, it's all of them. And so this is incredible, because this is what's gonna go into her buttocks. What's gonna go into her buttocks is this beautiful yellow fat. It doesn't need to be treated in any way, right? So we don't spend the time processing the fat. That's important, because, you can go very fast here, but then what comes out is all red, then you gotta treat the fat. There is, companies that, sell you, systems to clean the fat, and we don't need it, because, honestly. Okay, so she's on her side, the buttocks are over here. We're gonna do a fat transfer to the buttocks, but what I want you to see is that I'm gonna go ahead and do what is called the pinch test, and notice this. See, when I do this, see how there is absolutely no excess fat here. See, and this is part of the surgery. We want to make sure that it is even and even Steven, right? See, everywhere, and even here. See, you want to be able to do this in a nice way so that there is no excess fat. Thank you. Okay, so now I'm going to show you the pinch test on this side. See, this is what it looks like, no excess fat, right? She does have a little bit of excess skin, but not a lot. I'm not sure it's worth cutting this, but this is what it is, all over. See, very little. Thank you. Notice the waist. You see how, look how it's scaped in. This is her waist right here. See, very nice. Thank you. Wow, so what's coming out, Nicolas?
We got some bright yellow fat. Wow.
And that's what's gonna go into her buttocks. So pure yellow fat without any stain of blood. But it's a special technique. It's a different kind of anesthesia that is well known to everybody, but the way we do it is different. Same thing. So we are done with this again. See, this is the pinch test, right? So no excess fat here, no excess fat here, you see? And like that. So you can go this way too. You can see it better this way. See, no excess fat. You can see it better. No excess fat. See? That's what we do in a nice waist. And it's like that all over. See? Like that. Thank you. Okay, so we're doing ultrasound guided gluteal fat transfer, meaning that we are watching exactly where this fat is going. This is incredible. Look at the quality of that fat. Just follow that fat all the way around. And what is, didn't I tell you, this is the fat that we're going to put in here? The fat that we're putting in here basically is pure, beautiful fat, right? This is incredible. Look at that beautiful aspirate. You see that fat going in?
Yes.
Incredible, right? Here under ultrasound guidance at the Cosmetic Surgical Center of Costa Rica. Impressive, right? Very, very nice. Thank you.
Alright, so we're doing ultrasound guided gluteal fat transfer. This is Dr. Patino's cannula right here. It's the bright line that's in the middle. This is the deep gluteal fascia.
I'm wiggling it.
Wiggled it so you can see it move. This is the deep gluteal fascia. This is the muscle. You can actually see the striated muscle. It's very beautiful. This is where we don't want to be putting any fat, which is why doctor's right here above it. This is the superficial gluteal fascia, and that's the patient's skin.
Then I withdraw a little bit the cannula, and so I'm going to give it a bolus so you can see.
So what we're going to notice is fat is going to enter
You
this
see the
space.
tip of the cannula?
Let's see it.
That's the tip. Point to the tip, right there. And now pay attention. There's gonna be a cloud of gray stuff. That's the fat going into that. Point the tip again. 1, 2, 3, go.
So you can see the fat's already entering the space. The deep gluteal fascia is getting pushed down. Superficial gluteal fascia is being pushed up. As fat enters the space.
Thank you.
Alright, so this is Dr. Patino's cannula right here. This is the deep gluteal fascia. This is the striated muscle. This is the superficial gluteal fascia, and that's the patient's skin.
And I'm gonna wiggle the cannula again. Can you see it wiggling there?
Wiggling there.
And I'm gonna withdraw it. Can you see the tip?
We can see the
And
tip.
I'm gonna go ahead and give it the cloud of fat. You see the fat going in?
Yep, so we see fat entering the space, and you can see the deep gluteal fascia is getting pushed down as fat enters the space.
Thank you.